Esophageal cancer, cancer in the food pipe. What are the symptoms? What causes esophageal cancer? But unfortunately, cancer can occur at any age, young people too. We should not be complacent that it cannot happen to us. We are too young. So there are a variety of reasons for developing esophageal cancer. In this video, I will go through the key symptoms, the ones you should never ignore. Let me tell you a story. I had a 24-year-old young man who had come to my gastroenterology practice with symptoms of what he described as a repeated gastric issue. He's been having various anti-acid medicines, seeing different doctors. When he came to see me, he was continuing to have the same symptom, but on further questioning only, when I prompted him, he started to admit that he was having some difficulty with swallowing food, which he was just dismissing that it's only to some hard foods like roti, bread, or some kind of dry foods. After spending some time in consultation, he finally agreed to undergo endoscopy. Endoscopy, as you all know, it is a simple camera examination with a tiny tube with a light source where we look at the food pipe and the stomach. Unfortunately, despite his young age, he had what looked like a fairly advanced esophageal cancer. Cancer was big enough that even our tiny endoscope, which is the size of a pencil, cannot go through. No wonder he was having difficulty with swallowing the food because of the growth in the food pipe. When we say cancer, we always think about people who are older, but unfortunately, cancer can occur at any age, young people too. We should not be complacent that it cannot happen to us. We are too young. Anybody can get affected. So we need to be vigilant. When there are symptoms that are persisting, one should not ignore. In this video, I will go through the key symptoms, the ones you should never ignore. Firstly, difficulty swallowing. If you're having difficulty with swallowing anything solid, and it is repetitive, or if you're finding it difficult to swallow the food and having to drink water each time to help the food push through, or feeling that the food is getting stuck in the middle or higher up, then that's a sign you should not ignore. If you're losing weight because you have lost appetite, you don't feel hungry, or if you're having difficulty eating or feeling full, the cancer may have already started affecting your nutrition. If you are noticing pain, discomfort in the chest, in the middle, which quite often people can describe as like a pressure or a burning feeling that sometimes can worsen, especially when you're trying to swallow or when you're eating food. Obviously, if you have central chest pain, if you get it all of a sudden, most people sensibly will go and get their heart checked by an ECG, and that's the right thing to do. But this kind of esophageal pain, what I am describing, it persists, it keeps repeating, and is often can be mainly when you swallow something or when you're eating. If you're noticing repeated acid reflux, burning sensation, so a bitter liquid coming into the throat, or if you're feeling like a congested feeling that is not getting relieved by repetitive anti-acid medicines, or it doesn't respond to the home remedies, this could be also a warning sign. If you have noticed a change in your voice or a cough that is not going away, then this could also be a warning sign. If you are vomiting, bringing the food back because the food is not able to get through into the stomach because there is a blockage in the food pipe, this should not be ignored. If you are having pain when you swallow food or liquid, that means there might potentially be a tumor that is causing blockage and also irritation to the food pipe. Now, why would somebody develop cancer, esophageal cancer, so young? Obviously, we associate a lot of cancers, be it in the food pipe or in the stomach, above the age of 50, 60. We do not always know why some people get it, but there are several risk factors. This may include the way we live. It may also include something in our own genetic material that unfortunately I can't change, you can't change either. But there are certain risk factors that we can change. Smoking tobacco or using tobacco in whatever form is a risk factor for most cancers, including esophageal cancer. So the chemicals in the tobacco, what you might be consuming, can directly damage the cells and that is lining the food pipe. So that can increase the risk of cancer development. Alcohol, if you are drinking regularly, especially significant amounts, this can increase your risk of developing esophageal cancer because regular alcohol intake causes damage to the food pipe, irritation, inflammation to the lining of the food pipe, which can eventually cause changes to the cells in the food pipe. If you are someone who is suffering from chronic acidity, reflux or heartburn for many years, this can also increase the chances because it can result in changes to the lining of the food pipe, what we call as Barrett's esophagus. So imagine like there is a paint that is being peeled off from the wall. So that's what happens in Barrett's esophagus, where the lining of the food pipe gets kind of damaged, and this can put you at a higher risk of developing esophageal cancer. If you are overweight, your chances of esophageal cancer increases. For people who are obese, carrying more weight, obviously there is a higher chance of them having this gastroesophageal reflux disease, which in turn can cause damage to the lining of the esophagus. There are dietary habits, of course. People who are consuming a lot of processed foods, a lot of non-veg, especially red meat. So regular consumption of hot liquids, hot coffee, hot tea, it can also sometimes cause thermal damage, injury to the lining of the food pipe. Foods that are low in antioxidants. So if you're consuming very little in the way of vegetables, fruits, and relying mostly on junk foods like pizzas, burgers, and these kind of processed foods, you're putting yourself at risk of esophageal cancer. If there is a family history of esophageal or stomach cancer, this needs to be taken seriously. There are certain environmental factors which is not something, unfortunately, we can control. There is toxins in the food that we are consuming. We can't afford to get organic food all the time. So there is pollution that has various particulate matter in the air that we are breathing. So we are exposed to all kinds of pollution, right from the food what we're consuming to the air what we breathe. So there are a variety of reasons for developing esophageal cancer. The key thing is, if you have symptoms, this should not be ignored because this could be an early warning that it might potentially be something serious. You should take advice from medical gastroenterologist.